I speak now to Sipokazi Fokazi, who is the Senior Health News Reporter at the Bhekisisa Centre for Health Journalism. I found an article incredibly interesting about how government clinics in South Africa, while they're facing recurring shortages of contraceptive medicines in South Africa, also now piloting a vending machine system for particularly young women to have access to reproductive health products, condoms, lubricants, but also sanitary pads, HIV testing kits, but also planning to add birth control pills as well. Sipokazi, really appreciate your time. First, let's talk about the shortage in reproductive health medicines in South Africa. If we want to promoting positive reproductive health choices, particularly for young women, why is there a shortage, and what is that shortage currently in South Africa?
Thank you, Lester, for having me. As we know that last week there was a new report from Stockhouse that suggests that poor planning problems and poor record systems, for instance, are part and parcel of the reason why we have contraceptive stockhouse in South Africa. And hopefully an innovation like this will be a solution to such problems.
So what are we currently not stocking? These are the contraceptive pill. Is these one of the medicines that are currently in short supply in South Africa, particularly in the public sector?
So from the report, what I understand is that we have birth control pills and injectables such as Depo-Vera are in current shortage at the moment. So all sorts of contraceptives seem to be affected by the shortage.
I find the program or the trialing of vending machine access to reproductive health options a very, very positive one. We do know that while there is a state policy to advocate for positive reproductive health choices, this also comes with a localized stigma for particularly young women. If you were to approach a nursing sister, clinic sister at your local day hospital, it often comes with a level of stigmatization. What is a vending machine system expected? What results is that expected to yield with young women, particularly going straight to a vending machine and saying, well, if I'm going to be seeking some birth control medications, I'm going to go get it directly there instead of going to a local clinic?
So as you have correctly pointed out, that one of the issues is access. They face barriers because one of the issues that young girls, for instance, experience at clinics is judgmental attitudes from healthcare workers. And this discourages them from seeking healthcare services, and hence we have a high rate of pregnancies, for instance, because they simply don't go to the clinics. So a solution like the vending machine will hopefully, according to experts that we've spoken to, they say it will give them more privacy. They don't have to go in such spaces where they will feel judged, because it will now be one-on-one, and there will be no other people that will be interfering in their privacy. And what I'm just thinking now, and also they will not have to stand in long queues. We know that how overburdened our public clinics are. So now this system will hopefully save them from having to stand in long queues before they can get simple things like birth control pill.
Let's talk about costs, Sipokazi. Who is currently funding a vending machine project, and in terms of the costs of having access to a pill or birth control medication? Who covers that cost?
I understand this is a project that is in partnership with the NGOs such as HIV. It's called HIV TB Care, and understand that CDC is also involved in funding this project, and it will be free of charge. Young women, hopefully that will be using it, will not have to pay anything, and so it is freely available to anyone. It is mainly targeted to young women, but I understand that anyone who wants to use it can use it. For instance, boys who want to access condoms can have it, and even adults can have it. Those who do not have time to go to the clinics, for instance, can access such services from these machines.
What about assessing a young woman's health first? If you approach a clinic or a doctor, you are often first medically assessed. You are spoken to about the options of whether you are administered the pill, you are administered an injection, you may have other forms of reproductive health choices. What about having access to first the screening or the consultation first with a medical professional? How is that? How can you address that with a ease of access vending machine system?
Thank you, Lester. I think at the moment there's some regulatory issues that had been raised by pharmacology experts, for instance. We know that, for instance, when you go to the clinic, you meet a healthcare worker who will screen you and ask you questions. In this case, you will send a please call me to a Love Life number, and then they will connect with you and ask you some questions. For instance, if you are wanting morning after pill, then they will ask you when last you had sex and all of that. The long-term aim of this project is also to provide contraceptives. At the moment, they cannot because of the regulatory issues. The South African Pharmacy Council has some regulations on this. For instance, you have to have face-to-face contact with a patient before you can prescribe such medications, such as pills. But at the moment, it doesn't look like they are there yet. So that's why they are not yet prescribing contraceptives, but they are rather prescribing non-pharmaceutical items such as condoms and morning after pills and lubricants and sanitary pads, for instance. So there is still some regulatory questions around it about consultation and all of that. But yeah, the idea is that the healthcare worker from Love Life will ask you questions, why you need it, and those health questions. It's just not clear how things like blood pressure, for instance, will be taken, because before you get contraceptives, a blood pressure, for instance, has to be taken. It is not clear at the moment. I think that's what the regulation will have to look into, and that's why at the moment they are not prescribing contraceptives.
Sipokazi, would this have the opportunity to broaden the scope beyond just birth control measures, but maybe even, say, post-exposure prophylaxis? Many people, from what I understand, speaking to healthcare professionals, if they may have engaged in risky sexual behavior, they often don't then approach a doctor or a clinic to maybe inquire about, as you talk about, a morning after pill, and then secondly some form of post-exposure prophylaxis, because of the stigma that may come with having risky sexual engagement. Would there be, once there is some regulatory confirmation, could a program like this be extended to seeking post-sex medication, like a post-exposure pill, for example?
Lester, we're not aware of any such plans at the moment. I'm not sure if that is the plan, but for now, I think they are looking just into contraceptives and the other items that I've mentioned, such as condoms and all of that. There has not been any talks of PrEP.
Really,
so far. So
really appreciate your time, Sipokazi Fokazi, who's a health journalist at the Bhekisisa Centre for Health Journalism. Your thoughts on that? And I largely support it. Vending machines making it the likely of stigmatization of particularly young women, decreasing that chance. I know of the situations of young women who seek to make positive reproductive health choices for themselves, approaching a clinic and then stigmatized, embarrassed by many of the healthcare workers who are meant to protect their health. And so I think an ease of access would be quite opportune in this